Hello, hello. How's it going, people? We're doing another live today with Whitman-Walker. We have Dave coming in soon, so stay tuned. We'll be talking about a few things today with Whitman-Walker, so we'll be starting in a few minutes. So join, stay, share. We'll be starting a conversation soon. Today we'll be talking about HIV, LGBTQ, COVID-19, and pharmacy updates. So if that's something you're interested in listening about, stay tuned. Be waiting for my guests to come in. Hello, hello, hello. Good to see everybody. Come on in, come on in. We're gonna get started soon. Hello, hello, hello. Good morning, good afternoon. How's everyone doing? Hope everyone's staying safe. All right. Just waiting for the Whitman-Walker to... Hello, hello.
How's it going?
I'm good. How are you, Dave?
I'm good.
Getting all set up, you know. We have a lot to talk about today.
I know, right? I like your hair, by the way.
Thank you. It's long enough to twist. I twisted it. You see a little...
Yeah, it looks good.
Trying to do something different. I can't be coming up here with curly hair every time.
And your glasses. You look great.
Trying to stay as cute as Marshawn all the time, coming up here looking all fashioned.
Right.
I haven't given it to him yet, though. I've been good. I'm still home. We're going to get started. We got a couple minutes. We'll wait like 2 minutes. See if people join us. Hello, hello. Hello, everyone.
Hey, everybody.
We're having another conversation with Whitman-Walker. So if you want to stay and join us, ask questions. We'll have a lot to talk about today. So don't be shy. Today it gave me an option to put a title. So I don't know where it shows if there's a title in there. Do you see a title?
No, but it'll show at the end.
Okay,
You
perfect.
can enter it at the end, yeah.
I just copied and pasted and put it there too. I'm like everywhere. Pin. How's your week been going?
It's good. I think we're starting to get used to this quarantine thing a little better, I guess. So I've been good, It's been good.
Nice.
Yeah, my skin's looking good. I got a facial the other day. I'm so happy I was able to get that done.
Much needed. All right. Well, let's see. Well, for those of you who don't know, I'm Orlando Machuca. I work with Whitman-Walker Health Clinic as a social media influencer employee. My pronouns are he, him, sometimes she, depending on my mood. And how about you, Dave?
And I am David Wilson. I am also a social media influencer with Whitman-Walker. My pronouns are he, him, his. And yeah, that's it. And
so let's get started. So we have a lot to talk about today. So for those of you who don't know, during the past few months, Whitman-Walker's health community department has expanded an outreach and efforts to social media platform. We cover various topics about HIV, STIs, sexual health practices, access care, social detriment of health, and general public health interventions. In the next series of outreaches, we'll be focusing on the pandemic, COVID-19, ways to make your sexual experiences personal and mental health. The community health team is here to educate you. So stay tuned.
Yeah. So this is a unique, live. So we're going to talk a little about Whitman-Walker, why us and what's different. And so, with everything that's going on, like, this COVID-19 situation impacts the LGBTQ community a little different than it would our, hetero partners out here. And so we want to talk a little bit about that. So I'll be sharing some facts. So will Orlando on that, and we'll answer any questions that you might have during this time. So I want to read a couple of facts. So LGBTQ and minority communities are more likely to experience healthcare discrimination. Experiencing discrimination at your doctor's office can obviously discourage you from seeking care in the future. But in the middle of a health pandemic like COVID-19, delaying seeking care can have some fatal outcomes. So there are disproportionate amounts, higher rates of COVID-19 related infections and deaths in Black and Latinx communities. It is important to make a support plan in case someone you know or someone you live with needs access to medical care or needs to go to the hospital. So some facts here, the Human Rights Campaign, they've said that the LGBTQ population is less likely to have adequate healthcare coverage. That's obviously a big thing during this time, right? So 17% of LGBTQ people lack health coverage. 1 in 5 have not seen a doctor when they needed to because they couldn't afford it. About 37% of LGBTQ adults smoke every day compared to 27% of non-LGBTQ people. And so that's important, especially when this infection could impact your respiratory system. So more LGBTQ people smoke more than our non-LGBTQ counterparts. 24% of LGBTQ people have asthma as well, compared to 14% of non-LGBTQ people. Also, the CDC quoted for the period of 2008 to 2010, asthma prevalence was higher among children than adults and among multiple race, Black, American Indian, and Alaska Native persons than it is of white persons. So obviously our populations are more impacted by, the lack of healthcare coverage. So because of that, the LGBTQ population is also more likely to be exposed or suffer economically during this period. 1 in 5 LGBTQ people live in poverty, and these aren't good things to talk about. It's actually pretty bad things, and these numbers are saddening. But 40% of homeless youth identify as LGBTQ. That is clearly a disproportionate amount of people, and that number makes me completely sad, actually. The top 5 industries that LGBTQ adults work in are industries that are heavily impacted during this time. And that is affecting about 5 million, or at least 40% of LGBTQ workers. So that's compared to 22% of non-LGBTQ people. And so obviously we're more impacted by the pandemic at this time. It's a disproportionate number of people who work, of LGBTQ people who work in restaurants compared to that of non-LGBTQ people. That ratio is 15% versus the 6% of non-LGBTQ people. Only 29% of respondents in this HRC campaign, it's called the LGBTQ Pay Leave Survey. Of those participants, of those respondents, only 29% of folks actually had medical leave. So this is crazy. This is a time that's impacting a lot of people. The LGBTQ population is heavily impacted by this. And so Whitman-Walker wants to, if we can, share any resources to help out there.
For sure. So with COVID-19, there are a few reasons why LGBTQ folks, among others, minority populations, are more vulnerable to care shortages and economic harm related to COVID-19. Mm-hmm. So make sure you follow Whitman-Walker. We have links there about, cancernetwork.org, coronavirus 2019, LGBTQ info, increased rates of cancer, and HIV means that more LGBTQ individuals are, Immunocompromised. COVID-19 has more severe health impacts on folks who are immunocompromised. So the LGBTQ folks are 50% more likely to smoke. We are battling a respiratory virus. We also face a number of barriers to culturally competent and non-discriminatory healthcare. So meaning it could be harder for us to seek and access dignifying care for COVID-19 related needs. So LGBTQ people and all minority populations, including Black and Latinx communities, should try to do these things in addition to wearing a mask and physically isolating or distancing. Make a plan for if someone you know gets symptoms, where will they get tested? Where will they go for emergency care? Do they need to be accompanied? To be ensured that they're treated respectfully for their state of health and communicated with them accurately and properly. Know where affirming healthcare institutions are. So go to the www.hrc.org/HEI/SEARCH search. Whitman-Walker, Washington Hospital Center is the highest ranked. If you smoke, consider quitting, seeking out smoking programs to get rid of that, desire to smoke for now, and hire the treatment for other health conditions, whether that means learning how to use your provider's portal, stocking up on medicines, taking your medicines as directed, subsidized private insurance plan through DC Health Link. In DC, people who have recently lost their jobs provided health insurance have a 60-day enrollment period window for insurance marketplace. So there's more info of that as well for insurance enrollment across the DMV is available. So go to our page and you'll be able to see all those links, or you can call our public health benefits team, 202-745-6151 for additional support.
Absolutely. Yeah. And so, as we mentioned, physical distancing is not easy for anyone, but being LGBTQ during this time can really have an impact on your mental health. And so LGBTQ people are more likely to have depression, anxiety, and those things can be aggravated with physical distancing and physical isolation. So make sure you actively check in with your queer community and think creatively about ways that you can support each other. If someone needs help, they may not reach out. And so you kind of have to reach out to them, check on your friends, family, it's particularly LGBTQ people during this time. Also, try to make use of video chat, phone calls, FaceTime, all that stuff to make sure that you're connecting. Don't just use social media. I know we all love social media, but there's other ways to reach out and check on people. Also, use this time to immerse yourself in queer culture. For example, I've been reading a lot of books, watching queer and gay movies and TV shows. I actually rewatched all the Queer as Folk. So I was happy to do that.
Oh my Lord, that's a long one.
I know, right? But it really, that was a good moment. It made me feel connected to something. And I think that's important for us. So make sure you do some of that. Some of us may not realize it, but queer people may be forced to stay, with non-affirming parents during this time. And so they might be forced away from their chosen family and back to their biological one. So again, check on people, especially those people. Make sure they're doing okay. If this is your thing, make sure that you journal and write to express yourself. Journal and write to express what you're experiencing during this time period. Also, be sure to communicate how you feel with those you live with. You may be surprised of how accepting, someone will be if you explain that their non-affirming actions make you feel some sort of way. So if that conversation is not an option, try sending them a helpful article to explain why affirmation is extremely important. Also, there are online communities that you can take advantage of. Make sure, you check those out because these are important. They can save lives. And especially during this time, it's important, to check those things out.
Right. And being with that said, relationships, the CDC, WHO, and the Whitman-Walker Health discourage traveling to and from a partner's house if you don't live together. Consider video calls, sexting, etc. for interactions. Stay there. stay there for a while. If you need, if it's that important to you, hopefully, you know, they'll let you stay there for a while. You know, think of your relationship as a long distance relationship. Strengthen communication, set boundaries for how often you interact, what kind of interaction you have. This will mitigate anxiety and mixed messages when it comes to digital communication. Look at me stuttering over here. Treat each other extra kindly and practice compassion. Practice self-care. If you can't love yourself, you know the saying, right? Special note for those of you with MSM and IDUs are now able to donate blood. So the FDA revised a rule banning them from donating due to urgent need. So pretty much final summary action plan we talked about was make a plan for someone you know. If someone gets symptoms, where will they get tested? Where will they go in an emergency? Do you need to be accompanied or to ensure that they're being treated properly? Know where affirming healthcare institutions are at www.hrc.org/HEI/search. That's for the Whitman-Walker Washington Hospital Center is the highest ranked. If you smoke, consider seeking out smoking programs so you can, you know, stop smoking, especially now. You need to take care of those lungs. Adhere to treatment or for other health conditions, whether that means learning how to use your provider's portal, stocking up on meds, you know, just stock up on things you know are going to be related. You don't want to be going to the pharmacy too much and exposing yourself just to being in public, especially confined spaces. We don't know how many people are going to get medicine and why they're sick. They don't know why they're sick. So it's be super careful in those situations. Make sure you're enrolled in health insurance. Consider enrolling for Medicare or subsidized private insurance plan through DC HealthLink. Remember, in DC, people who have recently lost their jobs, provided health, have 60 days to enroll in an insurance marketplace. Info on insurance and enrollment across the DMV is available. And we also have those links available for you guys. It's whamu.org/story. And you can find that all on our page. We'll be sharing all that information.
Absolutely. And so, you know, Lando mentioned that, you know, it's important to stock up on your meds and make sure that you have those during this time. And so I want to give you all a little update on our pharmacy. So during COVID-19, our pharmacy at Whitman-Walker, we have two. So the one on 14th Street Northwest and the one on Martin Luther King Jr. Avenue Southeast, they're both open and they're delivering field prescriptions to you in DC, Maryland, and Virginia. So one thing to note, though, once delivery and payment information is confirmed with the pharmacy staff, delivery could take 1 or 2 business days. So you want to make sure that you plan. Don't wait until you run out to make that refill request. Let's make sure that you do that before, you know, you actually are done with your meds so that the refill could get to you just in time. Also, due to COVID-19, the pharmacies are experiencing an extreme high call volume, obviously because everyone has to call in order to get their refills delivered. So unfortunately at this time, this has led to some calls being dropped. If you are having a difficult time connecting with the pharmacy, you can try calling at 866-724-1805. And that line is available Monday through Friday, 9 a.m. to 5 p.m. Or you can visit the WhitmanWalkerPharmacy.com. So WhitmanWalkerPharmacy.com is the site. And make sure that you have your prescription number ready. It's actually on the top left of your pill bottle. And I know this because I do my refills online as well. So make sure that you call, have that number available, and they'll help you out with your refill. Also, given that not everyone has a place or, you know, what some may call a home, so they may not be able to get their prescriptions delivered to them. So the Whitman-Walker Pharmacy is offering limited, I repeat, sidewalk pickup services for anyone who cannot access the delivery services because they don't have an address. So the lobby of Whitman-Walker Pharmacies remain closed to the public, and clients have helped prevent new cases. So the reason we've done this is to help prevent new cases of COVID-19. So if you need these, you know, I guess, sidewalk pickup services, then you'll have to call the 866-725-1805 number. Again, these pickups, at these pickups, we're screening for symptoms. You have to wear a mask, and we're obviously practicing social distancing to protect both our staff as well as our patients. If the delivery option is the only option for you, then yeah, be sure to call that number and we'll help you. So the team is also working really hard to meet the care and needs of all of its clients. So if you are a patient, please, we appreciate your patience and understanding. We really appreciate it during this time as we try to navigate this pandemic and adapt to the changes that we have to deal with in healthcare. And so we're modeling a lot of these changes now due to COVID-19. So just be a little patient with us during this time.
All right. Did you see any questions today? Anybody have any questions?
I actually didn't see any questions, but I do want to thank everybody for joining. I want to give a shout out to Lisa on here. I love Lisa. She gave us
Lisa. Love Lisa. But yeah, besides that, everything else is good with you. You've been taking care of yourself.
Absolutely. I'm happy to hear that, the pharmacy is still supporting people, because there are a lot of people in, our community that needs, their meds, and Whitman-Walker does a good job keeping, us on track with those things. And so that is really good. I'm happy to hear that, we're here. I'm healthy. My puppy's healthy,
Right.
I'm good.
Cute
How
puppy.
are you?
I saw your puppy. Well, if that's it, then well, thank you everyone for joining us. Remember to maintain that 6 feet of physical distance. Wash your hands for at least 20 seconds, and stay home as much as you can. If you got to go out, take off your clothes, wash your hands. Try to isolate yourself in the room. If there's a lot of people in your house, I know we have to go out. Some people are going to work now, so it's difficult. Some people are going to eat outdoors, and a lot of places are opening up. So, all we can do is take care of ourselves and be nice to each other, because not everyone feels the same way right now about how, don't judge people, if they went out for a reason and whatever. Let people be, just remind them to take care of themselves, wish them well.
Absolutely. And also, remember to follow us on Instagram, Facebook, as well as Twitter at Whitman-Walker. And continue checking out our website. The website is www.whitman-walker.org. We keep the most up-to-date information about our services there, as well as more information about COVID-19 and just general Whitman-Walker health services. So if you have any questions about anything Whitman-Walker related, any of the services we provide, be sure to call us at 202-797-4439, and we will be glad to help you.
And definitely be on the lookout. We have lives every week, whether it's me, Dave, or any one of our other social media influencers, just sharing information. We love to chat with each other, because that's the time we get to chat with each other, right?
All right.
All right, guys. Thank you so much for joining us. Until next time, you guys have a great evening.
All right. Thanks, Lando. Talk to you later.
All righty.
Bye.